Right now, East Tennessee Children's Hospital is reporting an unusual summertime spike in cases of respiratory virus. RSV usually affects young children during the winter months, but we want to take a look at this chart right here. The number of RSV cases in July alone is still more than the number of cases from the rest of the year. That's January through June combined. Reporter Jacinta Render spoke to a doctor about how to keep your family healthy.
Respiratory syncytial virus, or RSV, is typically seen in the winter months. Doctors say symptoms are similar to the common cold: runny nose, sneezing, and coughing. But in infants, it can be much more serious.
That's a virus that especially affects the youngest of our patients and makes them sicker, that sometimes they need hospitalization and temporary measures to get over that.
According to the CDC, RSV is the common cause of pneumonia and bronchitis in children 1 year or younger.
So we've been calling it kind of tongue-in-cheek winter in July, now winter in August, because of how much of that we are seeing.
In July, over 300 cases were reported by the East Tennessee Children's Hospital. This chart shows cases from November until now. Dr. Joe Childs, their chief medical officer, says what they are seeing is unusual.
So we have had up to 25 patients in the hospital at a time with RSV during the summer, which usually we have none.
He says the pandemic may have played a part.
But because of how we all stayed away from each other in the wintertime, this virus really didn't spread then.
Dr. Childs says the same measures people are taking to prevent COVID-19 can be used to prevent the spread of RSV. Just like with COVID, one of the best ways to prevent catching most viruses is to wash your hands.
Trying to stay away from situations where you could get exposed to of any virus.
In Knoxville, I'm Jacinta Render reporting.
And doctors in East Tennessee are currently working on a vaccine trial for RSV. They hope to start it soon.